Rett syndrome is a rare, severe, and progressive disorder that mostly affects girls of all races. It can impact your child's ability to speak, walk, eat, or breathe easily. It was named after Andreas Rett, an Austrian pediatrician, who was the first person to report on the condition. Parents or doctors usually notice signs of RTT within the first 2 years of a child's life. If your child has the condition, they often miss key milestones in development or lose abilities they used to have. There's no cure for this lifelong disorder, but early treatment may help your child adjust. Causes of Rett syndrome. Most children with Rett syndrome have a mutation on the X chromosome, usually in a gene called MECP2. MECP2 is present in more than 95% of Rett cases. It isn't clear what exactly this gene does or how its mutation leads to the condition. Researchers think that the single gene may influence many other genes involved in development. That's why two girls with the same mutated gene might have very different symptoms. Two other genes, CDKL5 and FOXG1, are associated with variations of RTT. Although Rett syndrome is genetic, children rarely inherit the faulty gene from their parents. Rather, it's a chance mutation that happens in DNA. Rett syndrome genetic testing. A blood test can confirm whether the MECP2, CDKL5, or FOXG1 genes are present. This can be useful to determine if your child has RTT when they show the symptoms. You can also be tested if there's a family history of the condition. Prenatal testing can check if a second child might have RTT. However, it's unlikely anything will turn up since the condition is nearly always random. The chance of having a second child with the condition is less than 1% unless the mother already has the MECP2 gene or one of the variants, which is uncommon. Still, you and your partner can get tested for gene mutations before you decide whether you want to have more kids. You can get more information by talking with an experienced genetic counselor. If a mother learns that she has an MECP2 mutation, her daughters who don't have Rett syndrome can choose to get tested once they become old enough to have kids. It could help them find out if they also carry the mutated gene. But even if one daughter has Rett, it's very unlikely that a sister would carry the gene as well. Rett syndrome versus autism. Both conditions can make it hard to communicate and socialize. But there are key differences. Rett syndrome usually happens in girls, while autism spectrum disorder is much more common in boys. Some symptoms of RTT don't happen with autism spectrum disorder. These include slowed rate of head growth, loss of hand skills, less mobility, and irregular breathing. A child with Rett syndrome usually prefers people to objects and likes when you show them affection. The opposite can be true in a child with autism spectrum disorder. How rare is Rett syndrome? About 1 in every 10,000 to 15,000 girls worldwide are born with Rett syndrome. The disorder is even rarer in boys. RTT is often misdiagnosed, so it could be more common than we think. How is Rett syndrome different for boys? When boys develop the Rett syndrome mutation, they rarely live past birth. Males have only one X chromosome, so the effects of the genetic mutation are much more serious and almost always fatal. Most baby boys with RTT show signs of it very early on, and they have health problems at birth or soon after. They need aggressive medical treatment, meaning treatment that's more intense than usual. Rett syndrome symptoms. The age when symptoms appear varies. Most babies with Rett syndrome seem to grow normally for the first 6 months before any signs of the disorder become obvious. Researchers once thought that children with RTT never showed any symptoms before 6 months. But more recent studies have shown that they sometimes have symptoms from birth. The most common changes usually show up when babies are between 12 and 18 months of age, and they can be sudden or progress slowly. Some symptoms of RTT include slowed growth. The brain doesn't grow properly, and the head is usually small. Doctors call this microcephaly. This stunted growth becomes clearer as your child gets older. Problems with hand movements. Most children with Rett syndrome lose the use of their hands. They tend to wring or rub their hands together or bring their hands to their mouths. No language skills. Between the ages of 1 and 4, social and language skills start to decline. Children with RTT stop talking and can have extreme social anxiety. They may stay away from or not be interested in other people, toys, and their surroundings. Problems with muscles and coordination. This can make walking awkward. It also affects the ability to chew and swallow. Trouble breathing. This can include very fast breathing, forceful exhaling of air or saliva, and swallowing air. Seizures. Most people with Rett syndrome have seizures at some point in their lives. It's also possible to have behavior changes. Children with RTT tend to become tense and irritable as they get older. At times, they may cry or scream for a while or have long fits of laughter. Some kids also make unusual faces, lick their hands, or grasp at hair or clothes. Unusual eye motion. This can include staring or blinking intensely, crossing eyes, or shutting one eye at a time. Trouble sleeping. Your child might have a hard time falling asleep at night and nod off during the day. Or they might wake up at night screaming or crying. Scoliosis. This sideway curve in the spine is common with Rett syndrome. It usually starts when a child is between 8 and 11 years old and gets worse with age. If it becomes severe, your child may need surgery. Irregular heartbeat. Many children and adults with RTT have this serious condition, which can be life-threatening without treatment. It's possible to have a few other symptoms, such as reduced reaction to pain, small hands and feet that often get cold, teeth grinding, bowel problems. Symptoms usually don't improve over time. They often get worse very slowly or don't change. It's rare for people with RTT to be able to live on their own. Rett syndrome stages. In general, there are 4 stages. But the way the stages unfold and the severity of RTT vary from child to child. Stage 1. Early onset. This stage usually happens when your baby is between 6 and 18 months of age. It lasts a few months to a year. The symptoms of the disorder are subtle and can be easy to miss. Your baby might make less eye contact with you and seem less interested in toys. They might also take longer than usual to sit up or crawl. Stage 2. Rapid destructive. Some doctors also call this the rapid deterioration stage. It usually starts when a child is 1 to 4 years old, and it can last weeks to months. During this stage, your child could lose the skills they used to have. It can happen quickly or gradually. You might also notice clearer symptoms of Rett syndrome, like slower head growth, unusual hand movements, rapid breathing, trouble moving or coordinating, and losing social and communication skills. Stage 3. Plateau. This stage can start anytime from preschool to adulthood, and can last for decades. Most of your daughter's life is in this stage. She may continue to have trouble moving, but she may cry and get irritable less often. Communication skills and hand use might also improve. She may start to have seizures during this stage. In general, children with Rett syndrome don't get seizures before they're 2 years old. Stage 4. Late motor deterioration. Your child may move less on their own or not at all. She may also have muscle weakness, limited range of motion in her joints, and scoliosis, which may require a back brace or surgery. Hand movements and breathing problems may improve a bit or stay stable. If she has seizures, she may get them less often, too. How do doctors diagnose Rett syndrome? Doctors can make the diagnosis by observing your child's pattern of symptoms and behavior. They'll probably also ask you about things such as when the symptoms started. Because RTT is rare, doctors will first rule out other conditions, including autism spectrum disorder, cerebral palsy, metabolic disorders, and prenatal brain disorders. Genetic testing can help confirm the mutation in 80% of girls with suspected Rett syndrome. Doctors also rely on what's called an RTT diagnostic criteria worksheet. It assesses your child's early growth and development. A diagnosis of Rett syndrome shouldn't solely be based on genetic testing because the mutation can be seen in other similar conditions. Rett syndrome treatments. There's no cure for RTT, but treatments can help with a child's symptoms. They should get these treatments for their entire life. The best treatment options for Rett syndrome include standard medical care and medication. Meds may help control symptoms such as seizures, stiff muscles, and problems with sleeping, breathing, the heart, or digestive tract. In 2023, trofinetide became the first FDA-approved drug to treat adults and children over 2 with Rett syndrome. Daebue can't cure RTT, but it improves many of the symptoms. Physical therapy. Physical therapy and using braces or casts can help children who need hand or joint support or who have scoliosis. Physical therapy can help them keep moving, sit more easily, walk better, and improve their balance and flexibility. Assistive devices such as walkers or wheelchairs might also help. Speech therapy. If your child has trouble talking, this could help them learn nonverbal ways to communicate and socialize. Occupational therapy. This can boost your child's ability to use their hands to do things such as putting on clothes and feeding themselves. If they have to make repetitive movements with their arms and hands, the occupational therapist might recommend splints that limit elbow and wrist motion. Good nutrition. Work with your child's doctor to make sure they're eating a balanced diet, which is important for healthy growth and better mental, physical, and social skills. Also, ask the doctor what you need to do to prevent your child from choking on food or vomiting while eating. Some children and adults with RTT benefit from being fed through a tube placed into the belly. Behavioral therapy. This might help if your child has certain behavior issues. It could also teach them good sleep habits that help them get a better night's rest. Supportive services. You can look into early intervention programs as well as school, social, and job training services for your child. Living with Rett syndrome. Each child with RTT will have different symptoms. Some may have a mild version of the disorder, while others have it more severely. Problems with walking and other motor skills may get worse over time, while other problems such as seizures and communication may improve. It's likely that your child will need help with feeding, bathing, dressing, and going to the toilet, but may eventually be able to do some of these things for themselves. You'll probably have to lift your child or help her walk. You and your daughter may need the help of a device to communicate. But she can still express a wide range of emotions and take part in many activities. Some kids may be able to go to school and learn how to socialize better. Rett syndrome life expectancy. Many girls with Rett syndrome can live at least into middle age. The leading cause of death is cardiorespiratory issues. Researchers are studying women with the disease, which was only widely recognized in the last 30 years. Current research on Rett syndrome is focused on gene therapy. Scientists are trying to figure out a way to substitute the malfunctioning MECP2 gene, as well as to locate other genes that may be involved in RTT. Support groups for Rett syndrome. Support groups for parents and other caregivers of children with RTT can be very helpful, especially since the disease is so rare and you may not know of another person with it in your circles. The International Rett Syndrome Foundation runs several Facebook groups for parents, siblings, single mothers, and others who have a loved one with RTT. For more information, go to the IRSF Connect website. Another support resource is Girl Power 2 Cure. Takeaways. Rett syndrome is a rare disorder that mostly affects girls. Babies who have it are normal for the first year to 18 months of life, and after that, they start regressing. They may stop walking and communicating, do repetitive hand motions, and have trouble with breathing, chewing, and swallowing. RTT is caused by the MECP2 gene on the X chromosome. Although there is no cure, the first drug to control symptoms is now available. Rett syndrome FAQs. Is Rett syndrome dominant or recessive? It's an X-linked dominant mutation. Do girls with Rett syndrome get periods? Yes, they get periods at the same ages and for the same durations as most girls without Rett syndrome. Some girls with RTT use sanitary pads or tampons. Others take birth control pills or injections to reduce or eliminate their periods. Is there a cure for Rett syndrome? No, there's no cure yet. But there are a lot of therapies and medications to help people with the condition have a good quality of life.